Understanding chickenpox, a common childhood illness that has affected countless children over the years. Chickenpox, also known as varicella, is a highly contagious disease that spreads easily from person to person. It is caused by the varicella zoster virus, or VZV, which is a member of the herpes virus family. Most cases occurred in children under the age of 10, making it a rite of passage for many. Chickenpox is characterized by an itchy rash that can be very uncomfortable for children. The rash includes small, fluid-filled blisters that can break and form scabs. These blisters can appear all over the body, including the face, scalp, and even inside the mouth. The good news is that chickenpox is usually mild and self-limiting in healthy children. Although unpleasant, most children recover quickly without any long-term effects. However, chickenpox can be more serious in some people, leading to complications. These include infants, adults, pregnant women, and individuals with weakened immune systems who are at higher risk for severe disease. Recognizing the telltale signs, symptoms of chickenpox. Chickenpox typically begins with a fever. The fever is often accompanied by fatigue and headache. These initial symptoms may last for a couple of days. Then, the telltale rash appears. The rash usually starts on the torso. It then spreads to the face, arms, and legs. The rash progresses through stages. It begins as small red bumps. These bumps develop into itchy blisters filled with fluid. The blisters eventually crust over and scab. New bumps may continue to appear for several days. Chickenpox spreads easily and rapidly, making it a highly contagious disease. How the virus travels. Chickenpox is highly contagious, and understanding its transmission is crucial. It spreads very easily from person to person through direct contact and respiratory droplets. The virus spreads through the air when an infected person coughs, sneezes, or even talks. This can happen when an infected person coughs or sneezes, releasing tiny droplets into the air. The virus can also spread through direct contact with the blisters, which contain the virus. A person with chickenpox is contagious from about 2 days before the rash appears, making early detection difficult. They remain contagious until all the blisters have crusted over, which can take several days. This means that chickenpox can spread before a person even knows they are sick during the incubation period. This is one reason why the virus can spread so quickly, especially in settings like schools and daycare centers where close contact is common. Vaccination is the most effective way to prevent the spread of chickenpox. It not only protects the individual but also helps in controlling outbreaks in communities. Good hygiene practices such as regular hand washing and using hand sanitizers can also help reduce the spread of the virus. Isolating infected individuals until they are no longer contagious is crucial in preventing further transmission. Comfort and care managing chickenpox symptoms. There is no cure for chickenpox, but there are ways to relieve the symptoms. Treatment focuses on relieving itching and preventing infection. Cool baths with oatmeal or baking soda can soothe itchy skin. Calamine lotion applied directly to the blisters can also help. Keeping fingernails trimmed short can prevent scratching. Scratching can lead to infection. In some cases, your doctor may prescribe medication to relieve itching and prevent complications. It is important to keep children with chickenpox well hydrated. A word of caution. Aspirin and chickenpox don't mix. It is crucial to avoid giving aspirin to children with chickenpox. Aspirin use in children with chickenpox has been linked to a rare but serious condition called Reyes syndrome. Reyes syndrome can cause serious liver and brain damage. It is potentially fatal. Acetaminophen like Tylenol or ibuprofen such as Advil or Motrin are safe alternatives to relieve fever and pain. Shielding our children. Prevention is key. The best way to prevent chickenpox is through vaccination. Vaccination not only protects the individual child but also helps in creating herd immunity, which protects those who cannot be vaccinated due to medical reasons. The varicella vaccine is safe and effective. It has been rigorously tested and monitored for safety, ensuring that it provides strong protection against the virus. It is usually given in 2 doses. The first dose primes the immune system, and the second dose boosts immunity to ensure long-lasting protection. The first dose is given at 12 to 15 months of age. This early vaccination helps protect children when they are most vulnerable. The second dose is given at 4 to 6 years of age. This ensures that children are protected before they start school, where they are more likely to be exposed to the virus. The vaccine is very effective at preventing chickenpox. Studies have shown that it prevents almost all cases of severe illness and significantly reduces the number of mild cases. When it doesn't completely prevent chickenpox, the vaccine makes the illness much milder. Vaccinated children who do get chickenpox usually have fewer blisters, lower fevers, and recover more quickly. In addition to vaccination, good hygiene practices are essential. Teaching children to wash their hands regularly can help prevent the spread of many infections, including chickenpox. This includes frequent hand washing with soap and water, covering coughs and sneezes, and using tissues or elbows to cover the mouth and nose, and keeping children home from school or daycare when they are sick. By following these practices, we can help protect our children and community from the spread of chickenpox and other illnesses.